Hello, everyone. Welcome to our ASNC interview series titled Highlights of the ASNC 2024 Meeting. And here today we are with Dr. Larry Phillips, the current ASNC president, and Dr. Robert Hendel, ASNC past president. And we'll be interviewing them today to get their thoughts on the meeting. So I'll just like to both open up to both of you guys. Can you both share what excited you the most about the ASNC 2024 meeting this year, Larry?
Well, first of all, thanks, Renee. It's really great to be with you, and to have you being the interviewer is a whole nother level on this great program. Um, I think the enthusiasm was probably what struck me the most about the meeting. It was palpable throughout. It was a constant running of fun. People were learning new skills. Um, it There was not a negative discussion. It was all about looking with a positive outlook at the future. And I think everybody walked away with new pearls and better clinical practice.
And Bob, how about yourself?
Well, first of all, thank you very much for asking me to be involved. And it's a thrill to watch what has happened with ASNC. And I totally agree with Larry that the meeting had a bigger buzz than I've seen in many, many years. And it wasn't just crying over spilt milk about reimbursement. It was really forward thinking. And the other thing that really struck me was the youth of the attendees. We had a lot of younger physicians, scientists, administrators, nurses than I've seen. And I think that's so healthy and so wonderful. A lot of the credit is to you, Renee. But I mean, you put together an amazing program, and I think it checked all the boxes and beyond. But the enthusiasm was truly there, and even the vendors, they were excited to be there. And Austin's a nice place, but I think it was the content.
Great, thank you. So this year, as you know, our meeting remained disease-based focused, and we also focused on innovations in the field and had a global theme. How does this align with the current trends in nuclear cardiology? Larry?
Yeah, so I think when we've looked at where nuclear cardiology has gone the last couple of years, it's become a big discussion about expansion of the field. Right? When I trained, nuclear cardiology training was about perfusion imaging, often discussion about amount of ischemia and gatekeeper to the cath lab. And the evolution that we've seen in the field has been tremendous, with many focusing on amyloid imaging, sarcoid imaging, other molecular imaging beyond those, and infection, just to name a few. I think that we're seeing this explosion in nuclear cardiology. And by using disease state discussions, what we're able to do is two things. I think first, we're able to really expand the field of nuclear cardiology with dedicated training in disease state evaluation, which helps the attendee who might have expertise in one area and not the other gain new skills. The second thing I think it does is it really allows us to look at nuclear cardiology as a partner to other imaging fields and other clinical areas, both within cardiology and other specialties, to look at how we evaluate and manage a disease and the really key role that nuclear cardiology plays in it.
Right. So looking at the top innovations, Bob, in your opinion, what were the most exciting innovations or cutting edge research that was presented at the meeting this year?
Well, I think as we're talking about, the focus on disease states has really sort of allowed us to really look deeper into some of this. And, I think clearly the progress that the field has made in amyloid imaging and its applications is really paramount. And all you have to do is look at the program to see how many different amyloid sessions. I was struck by just how innovative some of the sessions were. I went to one session and I thought I was pretty well read in amyloid. I give talks about it, but I have to say it was on another level, and that's something unique. Most of the time, ASNC really sort of fills in the gaps for me. I think it does provide some basic education for everyone. But this time, boy, there were things that I've never heard about, and really cutting edge new markers and new applications, especially for things like amyloid, AI, and other things. So it really was cutting edge. And interestingly, I excerpted some of the slides last week for a local talk here because it was so perfect and so great. The speakers were excellent.
Great, thanks. So Larry, looking at clinical impact, how do you foresee the research and clinical practices discussed at this meeting impacting patient care in the near future? Especially as you know, there's flurpiridaz that got approved last week. So how do you see some of these things impacting or patient care.
Well, if you think about how fortuitous was it, the sessions on really innovation and radiopharmaceuticals. In prior years, we have the discussion and it becomes more of a what if there was a change? And then now, very shortly after the meeting, the FDA approves flurpiridaz. And I think the focus in this meeting was really poignant to look at what's going to happen in the near term. So I think that we saw the reasons for expansion of cardiac PET. We saw the evidence supporting it. We saw the innovation there. And what I think is going to happen is people who attended the meeting both virtually and in person are going to go home with that enthusiasm to take the next step. And not just to take the next step, but to use the ASNC resources to help support them in the infrastructure to build it. I think that everybody who attended the meeting went home with a change in practice. And I think that's the key to a meeting like this, to take the time away from your day-to-day activities to attend either virtually or in person. There has to be that immediate impact. And I know I have a list of things that I'm taking home. My team at NYU Langone, we meet afterwards and say, well, what did we learn in the different sessions and what are we going to do differently? I think in the long term, people saw where the future is and they saw what changes they need to make today, whether it's hardware purchases, software infrastructure, education, in order to be at the top of their game as we see the evolution of the clinical research that was shown.
Right. So turning over to hot topics. So Bob, this year, what key topics or debates generated, in your opinion, the most buzz among the attendees?
Well, in terms of debates, I don't think there was much debate. There was, such a positive emphasis on what nuclear cardiology is providing. It's hard to argue against some of the things. I think, clearly, blood flow has taken front and center. And I think, everyone is paying close attention to it because we do recognize, certainly at least with SPECT, that we thought we had limitations. And then enters, PET blood flow, which is great. Now we're looking at development of SPECT blood flow. It's going to be interesting to see how that also translates with flurpiridaz, as you've just heard. So we may have additional opportunities. But, there was just this general excitement of taking a lot of these things, which are not, in the future, to, it's now. I mean, and as you point out, with the release of flurpiridaz, people are now saying, oh, wow, this is really practical information. And I think, the OnDemand series from the meeting is going to offer that opportunity for people now saying, oh, yeah, flurpiridaz is out. Now I can go back and look at the ASNC meeting, and the OnDemand stuff will provide that education.
Great. So this year, as you both know, we had Dr. Vaskin sit in as our Mario Varani Lecture Awardee, and he spoke on 50 years of myocardial perfusion imaging, giving a history and evolution of the field. So question to both of you guys, what is the significance of Dr. Dilsitzen's contributions to the field of nuclear cardiology? Bob, I'll pose it to you first, since you've had a longer history in the field, and then Larry, I'd like to get your opinion as well. So Bob?
Thank you for saying longer, not older. I appreciate that. Well, Vaskin and I joined and actually formed, we were both founding members of ASNC. And Vasnik and I basically started at exactly the same time. We had the same mentor, Bob Bono. He worked at NIH and Bob came to Northwestern when I was there. So, we overlap a lot. And Vaskin has really been, a seminal leader in nuclear cardiology. He's one of the gods of myocardial viability and really established that field. He's done some very interesting molecular work with ACE inhibitors. His level of science is very high, but he also has a way of making it so practical and so understanding. And, his overview of myocardial perfusion imaging, it's a little amazing to say 50 years of, but, he did such a great job, and Vaskin has been instrumental in its development.
And Larry, how about yourself?
So, in thinking about the talk, there's a quote from my favorite movie, which is Hitch. I know, surprising. That you have to know where you've been to know where you're going, and I'm paraphrasing. What I found really poignant about Vaskin's talk, besides the breadth of his involvement over the last 50 years, was when trainees of today take certain things as facts within nuclear cardiology, but don't think about the evolution that it took to get there, right? And by knowing the thought process that went into making a decision at a time in the past, it really brings into focus as we see new developments that might seem small at the moment, but has the potential for expansion to actually look at them with eyes wide open and think this could change the field. And it's exciting to see, as hearing his lecture and then, for example, the young investigators and the poster sessions and seeing the discoveries that they're making, knowing that when this lecture is given 50 years from now, that some of these people are going to be the ones that are referenced in it. And it kind of brings it in full circle for me.
Great. So turning over to the must-attend sessions. So, the on-demand program for the meeting got released last week. But for those who couldn't attend all the sessions, what are some of the must-attend or standout presentations for the meeting that you would recommend, Bob, that the on-demand attendees should listen to, Bob?
I'll just pick out one, and I'll let Larry address some of the other things. But, to me, if you're not into amyloid imaging and understanding how to do amyloid imaging, when to do amyloid imaging, how to use the information, and really forward think using our tools in that disease state, that's where you need to be. And I think clearly those were must-do sessions. And I'm proud of nuclear cardiology as a field. I think we finally have stopped saying, oh, well, you could do this or you could do that. We're now saying this is the pattern. This is the algorithm. This is how you use this information. These are how you do the tests. We're very definitive now. And I think as I went through the meeting, even the different sessions, even though they may have a different focus, one was more science, one was more practical, one was more looking at population-based approaches with amyloid. They all came together and they all were, synergistic. And I think clearly those were the must sessions from my standpoint.
Larry, how about yourself?
Yeah, I think, the plenaries were really good this year. And I found that I was sitting there scribbling notes throughout. I think, focusing on one, I'll say Sharmila Dorbala's talk on PET. And the future importance in amyloid imaging was really excellent. I also found that there are a bunch of meetings that take place, so getting pulled out of sessions, I was able to 24 hours later watch them. So watching some later on, the other plenaries, the discussion of the business of medicine, which really was synergistic with the clinical practice. And I found that actually one of the lectures I went back to look at some of the points again. I think that, Bob mentioned cardiac blood flow and really learning on blood flow. The one I haven't been able to watch yet that I'm excited to see how it translates in on demand is Jeopardy, because I kept hearing from people afterwards that it was really funny and that it's good to have that as part of the on-demand. But I think that the sessions were great. And the way I knew that the sessions were great is at times I would go in the expo area during session times, and they were empty. And then all of a sudden the session would empty out and the expo would fill up. And what I knew were two things. First, I knew that it wasn't that people were skipping town and going somewhere else during the meeting time. They were on site, but that the sessions were so good that they needed to make sure they were in learning sessions and only taking advantage of the expo at the other times. And I think if you put that together, that parlays into a really successful meeting.
So along those lines, Larry, I know we had the cases from the community. Were there any memorable clinical cases or learning sessions that stood out in your mind from the meeting?
Oh, I really enjoyed the cases. I think that that's one thing. I hope we can find a way to have those more available on demand too. I know that that's a limitation. I found some of the amyloid cases to be really helpful. Inflammation and how people look at them. The SPECT cases that people look at high-risk features. I think that the advances we've had with the number of cases in the meeting really translates into the merger of the theoretical science to the boots on the ground. And what I found, and when I talked to my colleagues that were there too, those cases, those are the real cases I see day to day in clinical practice. And what it allowed us to do is to kind of have the debates and have, big names in the field that are debating how they would approach it. And And for the rest of us, it was a great opportunity to be able to just listen to them and learn from them. And so those are some of the cases. And I'm always amazed that those cases sessions are standing room only. They're packed. And it really, with that excitement and that attendance, it made it really good. So a lot of cases coming through at this meeting.
Right. So as you know, ASNC has had a mission to, be a diverse and inclusive society. And I know, Bob, this is, work that's special to your heart. So looking at disparities in care, how did this year's ASNC meeting address healthcare disparities, particularly in the realm of nuclear cardiology, Bob?
Well, I think there's been certainly a growing awareness and a need for health equity. It's been featured, Kim Williams brought it up multiple times. I've also brought it up. We're all learning what to do. I mean, I think we have some pretty good algorithms. We know some of the protocols. I think the knowledge base of a lot of people performing nuclear cardiology, and especially those that take the time and energy to attend either virtually or in person. But the issue is, how do you deliver healthcare? And I'm really focused in on this. I've spent a lot of time at the American College of Cardiology with this. And I think ASNC is realizing, in order to deliver that equitable care, we have to make sure this penetrates everywhere, okay? And especially with a disease state like cardiac amyloidosis, which hits a minority population usually. And, we have to make sure that it's there in the community. And I think ASNC, with the growing awareness of some of these issues and the tools that we have everywhere. I've had the pleasure of traveling to about 30 different countries to give presentations, and it always amazes me. They have SPEC, they have PET, they are knowledgeable, but we need to make sure we deliver the care and offer our tests to all people and all populations throughout the world. And I think ASNC has had that mission, certainly over the last 20 years. It has really grown.
Right. So Larry, looking at diversity in terms of participation throughout the meeting, how did the meeting this year foster that participation and inclusion from underrepresented groups in cardiology? Larry?
Yeah, well, one thing that I found to be a real positive of ASNC is the leadership development that takes place at every levels, right? So we had the Future Leaders program, we have the Leadership Development program, and then we have tremendous mentorship throughout the community. And what I find that translates into is really a diverse group of clinicians getting involved at every level, so that when it comes to our panels and our plenary, that allows it to really be a diverse group of opinions that are being heard and people that are presenting them. And I think it was a great success this year. And because it's so fundamental to the organization, I think that we have the building blocks to have that success going into the future. So I think it's very good.
So Bob, looking at collaborations and partnerships, particularly interdisciplinary collaboration, do you see any potential collaborations or partnerships that could be fostered from the meeting, particularly with the ASNC, between nuclear cardiologists and other specialties, Bob?
Oh, absolutely. We're a referral specialty. We're out there, we're in the weeds on specific things that we do. But we've also developed the field, I think, so well. So collaboration with Amyloid Society and the American College of Cardiology, and I think also the American Internal Medicine population too. We have to get the message there. We are not, as cardiologists that I am, or a nuclear medicine physician, we're not the primary referrers. So if we're going to keep our field alive and robust, we have to make sure the message of what we offer is there. And I think we're doing a really good job. I think for a while there, perhaps some of our sister societies didn't recognize us, and there was growth and excitement with other modalities that were providing this. But our role is very secure, and I think in many cases growing, especially with the recent advances. So we need to build on that and also look at other specialties in medicine, whether they be surgeons to offer our preoperative assessment or nephrologists and GI with amyloid. A lot of opportunities here.
Right. And as you spoke about preoperative, I know the preoperative guidelines came out last week. So and I know ASNC was involved with that, Kim Williams. So very important document for those who haven't taken a look at it. So Larry, looking at global representation, how did ASNC 2024 engage with the global community of nuclear cardiology professionals? And, what do you see as future steps for the society? Larry?
Yeah, so ASNC's relationship with other organizations around the world is very strong. Over the course of the year, ASNC will have collaborative conferences with north of 20 different countries and their societies. And what comes to be fundamental as we talk to those leaders is their desire to come to our ASNC scientific meeting. That it's a collaboration of ideas, of meetings, of seeing the science and seeing where they can evolve in their science too. And I think one of the strongest things that we've done is have the hybrid component of it, and really by the support of IAEA, be able to have virtual attendees from around the world, over 80 countries having attendees at our ASNC scientific meeting virtually, and many countries having in person. And I think that strong collaboration continues, and it's going to allow us to look at nuclear cardiology's global impact rather than just thinking centric to the United States.
Right. So looking at technological advancements, Bob, AI and imaging. So artificial intelligence, as you know, has become increasingly important in nuclear cardiology. What advances in AI-driven diagnostics or imaging technologies were featured at the meeting, Bob?
Well, what I could understand, it's robust. AI is complex. Neural networks and machine learning are, definitely a part of what we do in nuclear cardiology. I think we've seen a number of locales across the country and across the world that have really taken our field, which is inherently quantitative and has digital data, and be able to use that in effective ways. And I think the growth of AI in all of imaging, but I think especially what we're seeing out of certain laboratories is really dramatic. I don't want to mention one without mentioning the other, so I'm not going to mention, but the sessions on AI just, to me, are really enlightening and show a path forward. I think we're still waiting to hear how that develops. I'm hoping that AI does not replace me as a reader. The quantitation in the past was sort of touted as, okay, then we don't need human beings to read this. Well, that turned out to be false. I think, but we've evolved and AI has evolved. I don't think we'll ever be replaced, but I think the developments are certainly going to make us feel much better about what we're actually looking at and how to come up with accurate evaluations. So AI is really, really exciting to see.
So Larry, along those lines, with regards to PET, SPECT, and CTA, how did the discussions around these three areas evolve at this year's meeting, particularly as it relates to integration into modern cardiology practice?
Yeah, we live in a multimodality world, and hybrid imaging is the key to future success. I think that what was clear in this meeting was not a bravado saying nuclear cardiology is the be all end all for all patients, all disease states, but rather that's a fundamental component of evaluation. And we need to look at all the tools in our tool belt and find out which ones help the individual patient. And with the multimodality world comes hybrid imaging. And we're going to see many more machines coming out that have multiple imaging techniques within them, and figuring out which patients need multiple imaging tests at the same time. And I think that's what we saw at the meeting. We saw that evolution taking place before our eyes, a support and respect for other imaging modalities and how we integrate them together.
So looking at future directions, Bob, based on what you're seeing at this year's meeting, where do you see the field of nuclear cardiology heading in the next 5 to 10 years?
Well, obviously, we need collaboration, first of all, and maybe we'll touch on that in a moment. But, I think our field is robust and mature. We're not on the descending limb. We're still growing, but we are a mature field. I think the expansion of PET now with flurpiridaz and possibly other new agents that are target specific and really getting at some molecular basis. But I think we're going to see a huge growth of PET scanners. The question is, we also have to teach society that, we have to share with neurology, ortho, and multiple other modalities, including oncology especially. We need access. So just to have a scanner, we've got to make sure that we can do the cardiac work that we really need to do because we have the data, we have the knowledge, we can move forward. And likewise with amyloid, we're learning a lot. I see expansion there, not only as a diagnostic tool, But I think we've learned that not only MR, but also nuclear can give us prognostication of people with amyloidosis and maybe the evaluation of treatment, even though we do not understand why it works or how it works. We know it does work, and we're now seeing with serial imaging potentially a way to track disease. So there's so much in the future here. We just have to make sure that we have the resources available and the knowledge out there in the real world everywhere to be able to offer those skills. And I think it's very exciting for the future.
Right. So we had a Young Investigation Award awardees, which was very, very popular at the meeting. So Larry, how did the meeting support these young investigators and early career professionals in advancing their careers?
Yeah, there's been a big focus last couple of years on bringing more early career, both trainees and physicians to the meeting. I think, really the top is the Young Investigators competition and hearing the science that's taking place around the world and the fact that, the submissions are really global in their impact and the folks that are doing it. But with the increased cases, it allows trainees to participate in the meeting, to have that ability to be present, the Future Leaders Program as well. And what we saw throughout the meeting is that the diversity of age of attendees, seniority, training levels, really was diffused and really was great. And I think that was one of the factors that really brought to the energy.
Great. So looking at challenges and opportunities for the field. So Bob, with regards to challenges, what challenges did the meeting identify for the field, and what are some of the strategies that could be implemented to overcome these challenges?
Well, this one sort of maybe goes beyond the meeting itself, I think, Renee, because I think the attendees are all believers. For the most part, we all buy into the value of nuclear cardiology. What the challenge is, though, we have expensive technology. We have expensive radioisotopes. We have expensive equipment. The overall bills that we generate are high. So, really, we need to get the message to the administrators and to other clinicians that we offer huge value that in the long run improves quality of life and saves money if you do things correctly. But we need to also focus on the business and to prove cost effectiveness, to be able to disseminate our technology, to make sure that the cost of the test is not prohibitively expensive. Like, for example, years ago when we developed MIBG, which is an interesting agent that we all wanted to use, but the price prohibits us from using it. So certainly, I think we have to recognize cost, business, and administrative aspects of what we do to ensure that we can provide the information that nuclear cardiology can deliver.
So Larry, along those lines, I know, we did encourage administrators to attend the meeting, and looking at it from a business aspect, how do you envision the future growth of nuclear cardiology, especially in light of the new innovations that were discussed at the meeting, flurpiridaz that was approved last week? So how do you envision, the growth of this field?
Well, I think that to your first part about administrators, I think we're going to be doing more and more to build in the collaboration between the clinical side and the administrative side, and making sure that we have enough material at the meetings that the administrators say, hey, this is a must-go meeting for me. And I think that when we build that team approach that includes the strength of the administrator with the clinical side, that's going to be there. I think the way that this meeting played into the growth of nuclear cardiology is really key. I think one area we're going to see more and more of in these meetings is the hands-on training. And we saw this in several ways at the meeting. We saw it in dedicated hands-on training for specific parts of nuclear cardiology, where everyone had their own computer, and learned software-specific advances. But we also saw it with the program we had at the end of the meeting, intensive PET training for early career nuclear cardiology folks. And I think we're going to see more and more of both of those. And when you have the hands-on training and you realize that advances the field, it's didactic, but it's also hands-on. This is going to be the place where people are going to want to go to get that. And I see future growth. And with all that, it's going to allow us to expand both the modalities within nuclear cardiology, the disease states, but also the ability to uptrain folks to be able to participate in that explosion in the field.
Right. So as we're wrapping up the interview here, so from both of you, what are the key takeaways for attendees to bring back to their day-to-day practice? So Bob, I'll ask you first, and then Larry.
Well, again, I think just, we have a very hard and large scientific background in our specialty, and that the field is not dead. We're not the Society of Myocardial Perfusion Imaging. We're not doing planar imaging, and yet we still have huge roles. And please use us in the care of your patients. And also coming back, it's time to plan to grow, talk to leadership at each institution. And the takeaway I have is, yes, we had a lot of nice science and delivery, but, we're also clinicians, and we can deliver this to pretty much everywhere. We need to pass that word along that, yes, we can provide, gaps in how you look at patients and evaluate. I think it's really important. I do think, though, that going back to some of the things that we've been discussing, we need to enhance a little bit of focus to help people come to those conclusions. And, previously I got to chair, as you know, the business sessions the year before you were chair. And I think that those are very helpful. We need to encourage people, as you suggested, to come and really grow it. And I think when used properly, everyone prospers, including hospital administrations. And we just need to keep the message moving forward.
Great. And Larry, how about yourself?
I think that this meeting was needed for strategic planning at every institution for 5 and 10 years from now. When we look at the innovation, some of which is happening now and some of which going into the future, there's the integral part of hardware, there's upgrades, that argument of why you need a new camera, why you need to change what you're doing. That argument was really clearly made at the meeting. And for those, you couldn't see every session. And so the meeting on demand is going to be very important to go back and see focus is there. But I think that we're really at a tipping point in nuclear cardiology where it's going from where it has been over years in evolution to really explosion in multiple disease states. And with that is going to have to be a focus on quality. These are not techniques that someone just picks up and starts doing the next day. There needs to be training. And the meeting and the ASNC resources are key to that success of making sure we innovate, we expand, and with high quality.
So just some final reflections from both of you. So Bob, I'll turn it over to you first as past president. What are some of your personal reflections on the significance of this year's meeting on your own personal day-to-day practice? And how do you see it impacting the future of nuclear cardiology in your practice? Bob?
Well, I'm going to look at it from the 30,000-foot view rather than just say one particular item. I think I'm fairly knowledgeable in some of the aspects of the field itself for me, but what I took away from was the vibrance of the meeting itself and of the interest that the attendees had. The sessions were packed. Everyone wants cases. Oh, that's always been the case, that they want more cases. But I think even the plenaries and the small group discussions and Jeopardy, people were engaged. People really wanted to learn, as we pointed out. I mean, every room was filled. And I think that's great. And I think it also translated to a lot of excitement from our vendor partners who were thrilled that the showroom was filled, in between breaks, and there were conversations. People want to buy equipment. They want to look at new products. I haven't seen that kind of excitement from us as a nuclear cardiology community in many, many years. And very often, a lot of our meetings were, oh, gee, that's a nice location. Here it was, no, I really want to go to the meeting. So I took away a real vibrance and a real future. As ASNC continues on and moves on decade after decade, things could get stale. But I think this year was really a milestone, maybe largely due to our current president, Dr. Phillips, but I think it really has changed the direction of where we are as a field.
And Larry, how about yourself?
So, first of all, it was a lot of fun. And so you learn and you have a lot of fun at the same time. I think that the meeting is important for everybody, whether you're the virtual attendings for the education or the meeting on demand. But I want to give a push for the in-person attendance. It's actually been fun to do this interview tandem with Bob, because I actually met him the second ASNC meeting I went to, as I remember the conversation we had. And it reminds me, for those who are now early in their career and are learning about the innovations of the field, the ASNC scientific meeting is where you go and you get to meet the people who made the discoveries, who created the field, who made that tipping point to the new innovations, and to talk to them. Because in nuclear cardiology, what's always fascinating me, and I hear this every year from the early career folks as we talk about it, is how approachable people are. And that you get to have a conversation, get to know them as people, and it makes it really exciting for the field. So in addition to what we've talked about in this time, the innovations, the education, the excitement about the future, so much of it's the people. And that's what will keep me going back to the meeting every year, getting to see these colleagues from around the country and around the world, and know that together we're building a field for the future.
Great, thank you so much. And I must say, it has been an honor and privilege to be the chair of this year's meeting. And I'd like to thank Larry and all the leadership for giving me this opportunity. I think it's very encouraging hearing the very positive feedback from both yourself, Bob, as a past president, and Larry as the current president of ASNC. And just to spin off what Larry had mentioned about coming to the meetings in person, I think ASNC, one of the very positive impacts that ASNC can have on your career is actually getting involved with the LDP, the future leaders, because like I'm pretty sure Larry was an LDP participant as myself. And I think, ASNC really fosters the growth of many early career folks to then take on leadership positions in the society and in your own institution. So I think for those of you who are early in your career and have not stepped into the ASNC space, I really encourage you to do so. And I really hope that this interview have given you guys, very positive highlights of the meeting, and hopefully provided you a great summary of the meeting, and really found this very helpful. So to our listeners, the on-demand access to the ASNC sessions was recently launched last week, and many of the lectures, some of which were highlighted in this interview, are all on that program, especially many of the plenary talks, the Varani lecture, the Zarette Awards as well. And this provides you with 28.3 CME credits and over 31 lectures. So if you have not gone onto that platform, please do so. And I'd like to thank both Dr. Bob Hendel and also Larry Phillips for really giving their thoughts on the meeting today. And I'd like to thank everyone for listening to our interview as a part of the ASNC interview series. And for this interview and all prior interviews, please visit the ASNC website at the interview series. So with that, thank you very much today for listening.
Thank you.
Thank you.